नमस्कार। वैक्सीनेशन पे प्रेजेंटेशन के लिए हमारे साथ हैं डॉक्टर मनोहर अगनानी जी, एडिशनल सेक्रेटरी, एंड डॉक्टर मनदीप भंडारी जी, जॉइंट सेक्रेटरी फ्रॉम द मिनिस्ट्री ऑफ हेल्थ। तो आई रिक्वेस्ट प्रेजेंटेशन शुरू करें।
नमस्कार। आज के हाइलाइट्स इस प्रकार हैं। द हाइलाइट्स ऑफ टुडे आर दैट एज ऑन today, that is 18th January 2021, 5 p.m., a total of 381,305 beneficiaries have been vaccinated for COVID-19. And as on today, a total of 7,704 sessions have been held. आज दिनांक शाम 5 बजे तक 3,81,305 हेल्थ केयर वर्कर्स को टीका लगाया जा चुका है और इसके लिए 7,704 सत्रों का आयोजन किया गया। आज की स्थिति में 18 जनवरी को 5 बजे तक के जो प्रावधानिक आंकड़े हैं उसके अनुसार सारे देश में 1,48,266 लोगों को टीका लगाया गया। टुडे बाय 5 p.m. in all the states, all India figure of beneficiaries who vaccinated is 1,48,266, with Andhra Pradesh 9,758, Arunachal 1,054, Assam 1,822, Bihar 8,656, Chhattisgarh 4,459, Delhi 3,111। आंध्र प्रदेश में आज 9,758 लोगों को टीका लगाया गया। अरुणाचल प्रदेश में 1,054, आसाम में 1,822, बिहार में 8,656, छत्तीसगढ़ में 4,459 और दिल्ली में 3,111। इसी प्रकार हरियाणा में 3,446, हिमाचल प्रदेश में 2,914, जम्मू कश्मीर में 1,139, झारखंड में 2,687, कर्नाटका में 36,888, केरला में 7,070 और लक्षद्वीप में 1,080। द फिगर्स फॉर वैक्सीनेशन इन हरियाणा फॉर टुडे इज 3,486, हिमाचल प्रदेश 2,940, 183, पंजाब 1,882, मध्य प्रदेश में आज 6,652, मणिपुर में 291, मिजोरम में 220, नागालैंड में 864, उड़ीसा में 22,569, पुडुचेरी में 183 और पंजाब में 1,882 लोगों को वैक्सीनेट किया गया। द फिगर्स फॉर तमिलनाडु आर 7,628, तेलंगाना 10,352, त्रिपुरा 1,211, उत्तराखंड 1,579 एंड वेस्ट बंगाल 11,588। तमिलनाडु में 7,628, तेलंगाना में 10,352, त्रिपुरा में 1,211, उत्तराखंड में 1,579 और वेस्ट बंगाल में 11,588 लोगों को कोविड का टीका लगाया गया। ये आंकड़े प्रावधानिक हैं। Now I would just want to say about the AFIs following COVID vaccination. So far, a cumulative of 580 AFIs have been reported. अब तक 580 adverse events following immunization रिपोर्ट हुई हैं और इनमें से 7 लोग हॉस्पिटलाइजेशन के लिए भर्ती हुए। Delhi had 3, out of those 2 have been discharged and 1 with fainting is under observation at Max Hospital. And in Uttarakhand, 1 is stable and under observation at AIMS Rishikesh. Similarly, for Chhattisgarh, 1 is under observation at Government Medical College, Rajnandgaon. Karnataka, 2 cases. So 1 is fine and under observation at District Hospital, Chitradurga. And second case is under observation at General Hospital, Chitradurga. So, अब तक इससे संबंधित 2 मृत्यु रिपोर्ट हुई हैं। There are 2 deaths have been reported. One is male, which is 52 years age, was resident of Muradabad, UP. He was vaccinated on 16th of January and died on 17th. The post-mortem was done by a board of 3 doctors, which revealed that death was due to cardiopulmonary disease. So there was pocket of pus in lungs and enlarged heart. This death is not related to vaccination, as per the postmortem report. The second death, which was reported, is a male of 43 years age, resident of Bellary, Karnataka. He was also vaccinated on 16 January and unfortunately died on 18th. Cause of death is anterior wall infarction with cardiopulmonary failure. The postmortem has been planned today at Vijayanagar Institute of Medical Science, Bellary, Karnataka. इनका पोस्टमार्टम आज करना
as first lines of defence against COVID-19 and other emerging infectious diseases, alongside full implementation of the WHO Health Emergencies Program, is fundamental. We note substantial operational and technical support has been provided to many countries by the WHO. Additionally, the overview of the global situation, progress made and impact in country, detailed in the Strategic Preparedness and Response Plan Monitoring and Evaluation Framework, provides useful guidance, identifying gaps for action. We appreciate WHO's efforts to support the preparedness of the Pacific region, in particular through targeted deployments of the Global Outbreak Alert and Response Network, as well as WHO's ongoing leadership, convening regional joint incident management team meetings and providing up-to-date epidemiological reports. Clear and credible information also continues to prove vital to response efforts. WHO's role in providing authoritative, evidence-based and timely information is fundamental to fight this pandemic. Australia is actively following the progress the WHO convened scientific study into the origins of COVID-19. We note the international expert team has arrived in China and expect they will have access to relevant data, information and key locations to inform their work. We continue to seek transparency and look forward to WHO's regular updates on progress. Global participation in the COVAX facility will support rapid, fair and equitable access to COVID-19 vaccines. Australia has invested in the COVAX Advanced Market Commitment to support lower income countries and eligible small economies to access safe, effective and affordable vaccines for their highest risk groups. Australia is also committed to ensuring access to safe and effective COVID-19 vaccines for the Pacific and Southeast Asia through our Regional Vaccines Access Initiative. Finally, it is crucial that countries are ready to receive COVID-19 vaccines when they are available. WHO's ongoing work to support the development and finalisation of national deployment and vaccine plans is critical to ensure an equitable global rollout of COVID-19 vaccines. Thank you, Chair.
Thank you, Australia. And now to Botswana, to be followed by Colombia.
Thank you, Chair. Botswana is pleased to deliver the statement on behalf of the Africa Region member states. We thank the Director General for the detailed and informative report on the COVID-19 response. The Africa region commend the WHO leadership and the coordination role across all levels in the COVID-19 response. The WHO's Health Emergency Program, which was established under the leadership of the Director General, Dr. Tedros, has been a key milestone in this regard. We appreciate the technical and operational secretariat support, missions, and expansion of the hospital bed capacity, infection prevention and control support, SARS-CoV-2 laboratory testing capacity. The region has utilized the tools available, including the COVID-19 strategy preparedness and response plan, partners platform, and the various technical guide and documents. We congratulate the Secretariat on the global collaborative effort on the access to the COVID-19 tool accelerator, which is a key initiative to promote equitable access to COVID-19 vaccines, treatment, diagnostic, and all other medical products. We look forward to an ongoing, transparent, and inclusive update on the successes of this initiative for the benefit of member states. Chairperson, the Africa region is concerned about the disruption in the global supply chain, particularly during the initial phase of the COVID-19 crisis, which significantly affected our response. We are, however, confident that the Secretariat, in partnership with other UN agencies and philanthropic organizations, will continue to ensure equitable allocation of critical items, which include personal protective equipment comprising medical masks, respirators, oxygen concentrators, pulse oximeters, ventilators, and other essential biomedical items for clinical care, particularly to low and middle-income countries. The region notes with appreciation WHO's ambitious target for the distribution of the COVID-19 tools, including the provision of 2 billion doses of vaccine to all countries by the end of 2021, and 245 million treatment courses, and 500 million diagnostic tests to low-income and middle-income countries by mid-2021. Chair, as reported by the Independent Panel of Pandemic Preparedness and Response, there is a great inequality in the COVID vaccine availability and rollout amongst and between nations. The report indicates that our region will be the last to receive enough vaccine coverage for public health impact is deeply concerning. We therefore call for the urgent global solidarity to prioritize investment in affordable and safe COVID-19 vaccines and equitable allocation based on the principle of fairness for public health impact. Regarding research and development, we thank the Secretariat for supporting several scientific studies on the new diagnostics, vaccine, and therapeutics. It is important for WHO to continue to ensure that representation of public health researchers and scientists of the region in WHO multi-stakeholder forums in order to expertise and forge networking partnerships. We appreciate support to assess member state readiness to deploy the new COVID-19 vaccines, diagnostics, and therapeutics effectively and efficiently as they become available. Chairperson, in conclusion, the Africa region commits to working with the Secretariat and partners to ensure readiness of the vaccine introduction. I thank you.
Thank you. And now to Colombia, to be followed by China.
Thank you, Chairman. We are grateful for the report which has been submitted by the Director General on WHO's response to COVID-19. It also, of course, covered the support provided to countries to help them build national preparedness and response plans to deal with the current health emergency. We hope that WHO will continue to provide us with general support so that we can implement our plans most effectively. Nationally speaking, Colombia has a contingency plan for the COVID-19 emergency. We've had that since April last year. And we also have a COVID-19 health response strategy. These plans include 169 different types of activity for the preparedness phase, 64 for the containment phase, and 70 for the mitigation phase, all of them based on scientific evidence which is available worldwide. At the moment, we're focusing on the mitigation stage, and under the leadership of the Ministry of Health and Social Protection, we have rolled out nationally a program for testing, tracing, and isolating cases so as to ensure that we can break the chain of transmission by picking up confirmed and suspect cases, isolating confirmed cases and their contacts, and carrying out testing. It has, however, been important to include financial support so that people will comply with self-isolation measures. Nonetheless, we still believe that the preparedness stage needs to be strengthened, and we would like to have support from WHO in this. Previous emergencies, such as the H1N1 and recently Zika, chikungunya, and measles outbreaks, have shown how necessary this is. They helped us, actually, those outbreaks, to improve our preparedness, and that has helped us to better tackle this pandemic. However, we still need to strengthen the preparedness phase further. We believe that WHO support on the preparedness issue is essential so that we can learn the lessons which the COVID-19 pandemic has been teaching us. Last but not least, we'd like to encourage WHO to continue with its advice on designing and building vaccination programs and plans so that we can begin our campaigns to vaccinate against COVID-19. We also urge fair and equitable allocation of vaccines, treatments, and diagnostic kits, and we hope that the organization will continue to help us monitor the impact of the pandemic on our basic health services. Thank you.
Thank you. And now to China, to be followed by Kenya. China, you have the floor.
Thank you, Mr. Chairman. The Chinese delegation thanks the DG for his report and appreciates WHO for its tireless efforts in response to the COVID-19 pandemic. China holds that WHO's efforts in response to the COVID-19 pandemic are very effective. Since the outbreak of COVID-19, China has always been open, transparent, and responsible by publishing timely information, sharing genome sequencing, primer, and the probe of the virus, as well as the experiences and the programs in prevention and control. Recognizing the difficulties of other countries in the pandemic, we have actively provided assistance to them within our capacities. We again urge all parties to strengthen cooperation, join hands to fight against COVID-19. Together, we shall build a community of a common health for mankind. Virus origin studies are of scientific nature. It needs coordination, cooperation. We must stop any political pressure. In the fight against COVID-19, China is willing to continue to support WHO's global emergency response in terms of personnel, finance, and materials. Thank you, Mr. Chairman.
Thank you. And now to Kenya, to be followed by Tonga. Kenya, you have the floor.
Kenya aligns her statement with that made by Botswana on behalf of the African member states. Kenya takes note of the report presented by the Secretariat to the Executive Board and appreciates WHO's continuing work on the response towards COVID-19 pandemic. We also appreciate WHO's operational and technical support provided to countries in the pandemic response activities, including building laboratory capacity, epidemiology, infection prevention control, case management, and data management. We acknowledge that WHO's coordination role in strengthening the global COVID-19 supply chain system to scale up the procurement and delivery of personal protective equipment, diagnostic products, and clinical care equipment to low and middle-income countries such as Kenya. Kenya reported our first case on 13th of March 2020. To date, the country has reported over 98,000 confirmed cases with over 1,700 deaths of COVID-19. To curb the spread of the virus, Kenya continues to maintain heightened surveillance at the point of entry, increased diagnostic capacity, dusk to dawn curfew, mandatory screening for travelers, as well as continued implementation of public health measures such as social distancing, hand hygiene, and mandatory use of face masks in public places. To ensure continued delivery of essential services in the context of COVID-19, Kenya, with support from WHO, has developed more than 85 protocols and guidelines to guide healthcare workers on continued service delivery amid the COVID-19 pandemic. On COVID-19 vaccine preparedness, Kenya seeks to vaccinate its population against COVID-19 disease using a phased approach, starting with at least 20 million individuals, that is about 40% of the entire population, over the next 2 years. The first phase targets to vaccinate 1.25 million frontline healthcare workers and other essential workers by June 2021. A ministerial advisory committee on COVID-19 vaccine introduction has been established to oversee the implementation of the country's vaccine rollout strategy so as to ensure equitable access and that most at-risk and vulnerable populations are prioritized. Finally, Chair, we call upon the global community to work together towards controlling the COVID-19 epidemiological situation and look forward to the gradual resumption of normal socio-economic activities in the foreseeable future. Thank you for your attention.
Thank you. And now to Tonga, to be followed by Singapore. Tonga, you have the floor.
Honorable Chair, WHO Director General, Your Excellencies, Maloelele from the Kingdom of Tonga. On behalf of His Majesty's government, I thank you, Chair, and wish to firstly acknowledge and salute the WHO DG's courageous global visionary leadership. I also wish to acknowledge the sacrifice of the WHO scientist team and staff, and global healthcare workers and researchers. We also would like to acknowledge the Regional Director, Dr. Takashi Kasai, ethical and inclusive leadership. The Kingdom wishes to acknowledge the WHO DD's report and his strong stance on equitable distribution of the vaccine. History will judge us tomorrow on what we did today, especially ensuring vaccines accessibility for those countries without wealth. We would like to acknowledge tremendous support provided by various partners. In the Pacific, we would like to acknowledge the support provided by Joint Incident Management Team, with major partners joining as team with WHO as Secretariat. While most of the Pacific countries remain free of COVID-19 or without community transmission, the pandemic has catalyzed government's acceleration of actions to achieve our commitment to universal health coverage. We strengthen treatment and laboratory capacity for COVID, and this will also contribute to better health service delivery for the future. We have also engaged with community leaders, governors, district officers, community police officers, and that have been the fundamental essence, unifying a nation from the bedrock of communities. As in many countries, Tonga is currently preparing for mass vaccination campaign. Tonga is applying for vaccine through COVAX facility. And with small island nation, the risk of a deadly pandemic can eradicate a generation. We have developed national deployment and vaccination plan. Under this plan, we will further strengthen our cold chain system, storage capacity, human resources, and health information, and pre-screening and preparation for potential side effects. We thank the continuous technical and financial support from countries and agencies. Finally, now is the time for supreme global, genuine leadership from all of us to ensure vaccination for all of humanity. Thank you, Honorable Chair.
Thank you very much, Tonga. We are mindful of the time difference for you and for many other member states. We should now like to call upon Singapore to be followed by the United Kingdom. Thank you, and Singapore, you have the floor.
Thank you, Chair. COVID-19 has had a deep and devastating impact on every country. Singapore has not been spared. The COVID-19 response resolution is a strong signal to the world that global solidarity is needed to win this war against the virus. Firstly, COVID-19 has reminded us of our interconnectedness and interdependency. Tackling this pandemic must be a collective effort built on international cooperation. As the specialized agency under the United Nations, with the mandate to act as the directing and coordinating authority on international health work, the WHO coordinated international health response to COVID-19 will continue to be strongly supported by Singapore. Secondly, we commend Dr. Tedros and the WHO for its continued leadership in mounting a global response at the international, regional, and national levels. The regular press conferences and member states' weekly briefings are extremely useful in keeping the world informed about the latest developments and guidance. This provides transparency and inspires confidence. With the emergence of concerns about new variants, WHO's continued leadership and technical guidance remains even more important. Lastly, while the world is beginning to see the light at the end of this very long tunnel, vaccines alone are not the silver bullet for now. Safe management measures remain key even as more people get vaccinated in the coming months. The world looks to WHO for leadership on technical guidance pertaining to the ability of COVID-19 vaccines to prevent transmission and how vaccination will interact with safe management measures. The next key challenge would be in the issue of verifying the vaccination status of travelers. An international authentication mechanism may be useful to aid the resumption of global travel and trade. Mr. Chair, let me conclude by saying that COVID-19 has shown the world the importance of investing in health emergency preparedness, especially in cities. As a small city state, our livelihoods depend heavily on Singapore being a key international and travel hub that remains open to the world. We must tread the fine line that safeguards both lives and livelihood. Singapore will continue to champion urban health emergency preparedness in the years to come, and we hope to work with like-minded partners to strengthen our collective resilience against future outbreaks. Thank you.
Thank you very much, Singapore. And now to the United Kingdom, to be followed by Sudan.
Estimado presidente, director general y distinguidos compañeros. Estimado presidente, director general.
Thank you, Chairman. Chairman, Director General, distinguished colleagues, no.
We seem to be having a technical issue. If we could kindly give the floor to the United Kingdom, please, who would then be followed by Sudan. I would please seek the help of IT in unmuting the United Kingdom. Thank you very much.
Thank you, Chair. Can I just check you can hear me?
We can indeed, and we can see you. Thank you so much.
Thank you, Chair. Science will reduce the impact of COVID. This includes drugs, vaccines and diagnostics, and international science is delivering them. As we all know, transparency and sharing information also saves lives in pandemics. The UK remains strongly committed to openness and sharing our experiences. We are very grateful to WHO and the international community for what they have shared and continue to share. The UK is currently at the worst point of this pandemic so far. Our health and social care workers are under immense pressure, and we are sure you will join us in paying tribute to their efforts and their colleagues around the world. We want to highlight two other items. Firstly, identifying important variants of the virus. Genomic sequencing helped identify new variants in the UK, South Africa, and Brazil. It allowed us to share information quickly with all nations through WHO and other channels to support your handling. The emergence of new variants is no surprise, but we need to be ready to identify significant changes quickly wherever they arise. This includes those which are more transmissible or may reduce vaccine effectiveness. This will allow us all to respond in a timely way for the benefit of all. Variants present a global challenge that will require international cooperation. We must quickly consider how to put in place the necessary processes and structures to support a systematic global approach. We recognise that the UK is fortunate to have genomics capabilities and are committed to supporting the WHO to provide international leadership in this area and ensure systematic global surveillance. Secondly, therapeutics. We are pleased that the UK life sciences capabilities have been able to support WHO to contribute to major advances on therapeutics, in addition to work on vaccines. We are grateful to WHO for their leadership in coordinating efforts and including the Solidarity Trial. There is a continuing need for trials to inform evidence-based global practice. For example, the Recovery Trial showed that dexamethasone, a low-cost and widely available drug, reduces mortality for COVID-19 patients requiring oxygen. It also demonstrated the lack of clinical benefit of other drugs, including hydroxychloroquine, and continues to explore other treatments with global relevance. The UK are also major contributors to other international trials, including REMAP-CAP. We remain committed to working in partnership to ensure global equitable access to safe and effective treatments and sharing research findings as quickly as we can. A strong scientific response, international cooperation and transparency are essential to get through this pandemic. By working together through science, we will save many lives. Thank you, Chair.
Thank you very much, and once again, our apologies for the issue in connecting you. I should now like to give the floor to Sudan, to be followed by the Russian Federation. Thank you, and Sudan, you have the floor.
I'd just like to confirm that you can hear me.
Indeed, we can. Thank you.
Honorable Chair, distinguished delegates, excellencies. Sudan welcomes the updates by the Secretariat and it commends WHO for their continuous prominent effort in catalyzing the global response to the COVID-19 pandemic. The pandemic has been a test for all of us, and while we now know much more than we did a year ago, we have a long way to go. Directing the bulk of medical resources of the country to address COVID-19, particularly with the increasing number of cases, we have strengthened our initial response to the pandemic, but in retrospect, it has hindered regaining full functioning of the health system, which has not only affected the response to the pandemic itself, but has held back the progress towards the ongoing crises crippling Sudan. Our current healthcare system, in need of support in terms of community-based COVID-19 surveillance, tracing, and tracking, must also be strengthened and reinforced. The collateral impact of the COVID-19 on all aspects sheds light on the critical the international community to provide holistic and support to the developing countries in their effort to tackle COVID-19, in addition to the steady strengthening of the capacity of the public health system and a pressing overall need for global solidarity. Sudan highlights the importance and calls on the international community to adopt a flexible funding strategy to rapidly tackle both COVID-19 obstacles.
Sudan, could you slow down, please? Thank you.
Sectoral approach to ensure equitable distribution of the vaccine. We are currently engaging relevant government entities to ensure a whole of government approach in the rollout process. We are also particularly...
Apologies for the interruption, Sudan. We're just being asked to kindly seek your indulgence in please slowing down the intervention somewhat for our interpretation services. Thank you so much.
Sudan highlights the importance of engaging in a multi-sectoral approach to ensure equitable distribution of the vaccine. We are currently engaging relevant governmental entities to ensure the whole of government approach in the rolling out process. We are also particularly keen on the involvement of the private sector on a national level, and we would like to encourage their early engagement on a global scale. We are currently working on finalizing the COVID-19 vaccine deployment plan with a nationwide rollout campaign expected to begin on the 1st of April. Sudan stresses urged WHO and member states to ensure equitable distribution worldwide. Finally, Sudan urges member states which have already begun the administration of the vaccine to speed up information sharing both in the region and globally. Thank you.
Thank you. Thank you very much, Sudan. And now to the Russian Federation. And just a reminder that should the Russian Federation wish to deliver their intervention in the Russian language, would kindly ask that it is said at a pace by which our interpretation services can interpret. Thank you very much. Russian Federation, just confirming that you would still be in a position to deliver your statement. You have the floor. Thank you. We might just try one more time with Russia, and should we not be able to connect, may I propose that we move to the next speaker and would come back to you. Russia, just again confirming that you have the floor. Thank you very much.
Вот все. Hello, can you hear me? Yes. Спасибо.
Thank you very much. Distinguished colleagues, distinguished chairperson. Since the first day when it was known that a new coronavirus surfaced, the WHO has ensured maximum full and open access to information about the virus. We'd also like to note the role of the coordinating role of the Euro Regional Office of the WHO in providing timely information to the countries of the Euro region about the spread of the virus. Given the situation throughout the world, this has become a very difficult period to face the pandemic. And this, of course, affects many different aspects. There has been information, development of recommendations covering different aspects of prevention and treatment of the virus. The WHO has published more than 200 different parts of technical guidance. And, of course, Russian specialists participated in this work. The documents, which were developed by the WHO, were used by the Russian Federation's work to compile recommendations for workers in different sectors, for example, industry, transport, tourism, and others. Since the very beginning of COVID-19, we came up with a strategy to deal with this. Pursuant to the WHO recommendations and also the international health guidelines, we took a number of timely recommendations to implement them throughout the territory. We developed test systems and carried out diagnostics and ensured that all hospitals were prepared. Thanks to the hard work throughout a number of different activities to come up with material and technical assistance and to analyze the infection, we were able to avoid an increase in the transmission level and to keep the disease under control. Russia also was able to provide assistance to other countries. We, for example, carried out some different 15 special missions in 11 partner countries. We were able to give them tools and personal PPE, personal protection equipment. The Russian Federation, for its part, also provided assistance to the WHO. For example, our government center, called Vector, which is the Government Scientific Center for Virology and Biotechnology, was included in the WHO Registry of Labs, providing assistance to the organization. And this, of course, helped the partner countries that also didn't have this type of technology. The Russian Federation contributed more than $4.7 million for the financing for fighting the coronavirus and, of course, for assisting other countries. Given the pandemic, thanks to the scientific traditions of virology and other studies in the Russian Federation, we were able to create the first vaccine against the coronavirus in the world. Today, pursuant to a decision of the president of the Russian Federation, we have started a mass vaccine program. The general director of the WHO mentioned this. And of course, the success of our efforts depend very much on our working together and following the requirements of the WHO to face this situation. The Russian Federation has sent the vaccine documentation to the WHO, and we're counting on a productive dialogue. We salute the WHO in its leading role, and we should all support it to fight the pandemic. I thank you very much for your kind attention.
Thank you very much. And now to Oman.
Chairperson, members of the EB, ladies and gentlemen, on behalf of the countries of the Eastern Mediterranean region, I would like to thank the Director General's timely report on the COVID-19 response. The spread of SARS-CoV-2 has provided the opportunity for significant expansion in national laboratory networks, surveillance, epidemiological capacity, and research in the region over the last year. We are grateful for the support from WHO in the global COVID-19 response through its leadership, coordination, and active engagement with member states on strategic and technical guidance and operational support. We acknowledge WHO's efforts in leading global research and promoting evidence-based information about COVID-19 to limit the spread of false information. We also recognize WHO's efforts in advocating for and facilitating transport, equitable and timely access to quality, safe, affordable, and effective COVID-19 diagnostic, therapeutic, and vaccines, taking into account existing mechanisms and tools. The member states of the Eastern Mediterranean region reiterate our commitment to improve and scale up the COVID-19 response and would like to call on the Secretariat's concentrated effort to support member states in the following areas. 1, improve surveillance data systems and reporting to global platform to increase understanding of the epidemiological situation at global, regional, and country levels, including the emerging variants. 2, strengthen supply chain to ensure acquisition of equitable allocation and transport of sufficient quantities of critical items. 3, ensure COVID-19 vaccine distribution is equitable and covers the most vulnerable population globally and nationally. 4, member states should implement and regularly update national multi-sectoral COVID-19 action plans based on specific contexts, priorities, and epidemiological situation, while taking into account the needs and vulnerabilities of all population groups. 5, member states should provide timely, culturally, and evidence-based information to the community, including on relevant risks and measures that they can take to protect themselves, engage communities in all aspects of preparedness and response, and actively address rumors, misinformation, and stigmatization. 6, member states should continue to develop and maintain national capacities for the early identification, testing, isolation, care for cases, and for the tracing and cleaning of all contacts. 7, support member states in decision-making on social measures and movement restrictions, applying inclusive, transparent, and evidence-based process in order to protect lives and sustain livelihoods. 8, member states to ensure continuity of essential health services during COVID-19 pandemic, including access to essential medicine and vaccine, and allocation of adequate human and financial resources. Thank you very much.
Thank you very much, Oman. And now to Guyana, and then we shall move to interventions by those member states not represented on the board. Thank you. And Guyana, you have the floor. Guyana, just wishing to confirm that you would still be in a position to make your statement.
Thank you very much, Madam Moderator. Thank you very much, Madam Moderator. Guyana acknowledges the comprehensive report from the Director General and the status report on Agenda Item 14.1. We would like to commend the Director General, Dr. Tedros, and his staff for their leadership in developing a multifaceted response to the pandemic, which has brought us much hope. To the world's population. We also want to thank the many persons who have contributed knowledge and resources to getting us thus far. Unfortunately, the pandemic is far from over. For us to successfully defeat the virus, it would require additional efforts and commitments to roll out safe and effective vaccines. We thank COVAX for their work, and we are happy to learn of the progress made in acquiring more than 2 billion doses of vaccines and the plans to start rolling out these vaccines by February. We commend COVAX for the work done so far, and I can assure you that all countries in the COVAX facility are anxiously awaiting their vaccine quotas. Guyana has been working very closely with COVAX over the last couple of months to ensure that we meet all the requirements for early rollout of vaccine. And in speaking with other stakeholders in the Americas region, they too are anxious for early rollout. We have all put the measures in place, both administratively, legally, and we are waiting the arrival of these vaccines. We hope as this process gets going, the WHO would assist us in developing a regional risk communication program to enhance the uptake of vaccines and to push back against the anti-vaxxers. In addition, we note with concern, the emergence and the spread of new variants of the virus. We will urge the WHO to assist poorer countries to get access to laboratories to do genetic sequencing. This would help member states to get a better understanding of the epidemic in their countries and for WHO to get a better understanding of how this virus is mutating and spreading. We thank you and we look forward to participating in the other areas of this meeting.
Thank you very much, Guyana. We shall now move to statements by those member states not represented on the board. I should like to give the floor to New Zealand, to be followed by the Philippines and then Canada. Thank you. And New Zealand, you have the floor.
Chair, Aotearoa New Zealand appreciates the global and regional leadership shown by the WHO throughout the response to COVID-19. This includes the important support provided by the organization to our own Pacific region. We recognize the important role that the WHO member states in sharing information and expertise as we take together global pandemic. In this regard, New Zealand is the confidence of WHO independent scientific expert to China. It is vital that the mission has every opportunity to understand what happened so that we learn from in order to the global health system and reduce risk of future pandemics. We look forward to a successful mission and to the findings earliest. Chair, New Zealand, the global established the COVID, which will ensure COVID-19 vaccines are distributed equitably worldwide. Having all vulnerable populations vaccinated will make an important contribution to this pandemic. New Zealand has contributed 17 million New Zealand dollars in funding to support the COVAX Advanced Market Commitment, which will distribute doses to developing countries globally. It is critical that funding targets are met to ensure vaccines reach 20% of developing country populations by the end of 2021. Cooperation in the COVAX facility and AMC to date has been impressive and a precedent-setting example of global unity in the face of crisis. We look forward to seeing this cooperation and mutual support continue 2020.
Thank you very much, New Zealand. Unfortunately, the sound quality was not perfect. That being said, we would kindly ask that you send us a copy of the statement and we can ensure that it is posted on our website. I should now like to give the floor to the Philippines, to be followed by Canada. Thank you.
Okay. Yeah. Thank you, Chair. Yeah. Can you hear me? Okay.
Yes. Thank you. Please proceed.
Okay. The Philippines expresses appreciation for the updates given today on COVID-19 and the response efforts from the global perspective. We appreciate as well the efforts placed towards support for making COVID-19 vaccines, diagnostics, and therapeutics accessible in an equitable manner and remain supportive of the solidarity effort in this regard. The Philippine delegation is proud of the work of our compatriots throughout the world, especially those in the migrant, domestic, and health workforce who have been actively engaged in the various front lines of the fight against COVID in their host countries. With this, allow us to emphasize that support to risk communication and community engagement is very critical in ensuring that medical professionals are fully equipped on vaccine administration, advocating the vaccination program, and encountering misinformation and disinformation surrounding vaccines. We also highly appreciate the technical and operational guidance on maintaining essential health services in the context of COVID-19. The Philippines fights COVID-19 while pushing our universal healthcare agenda forward to ensure holistic healthcare and adequate health system capacities. We value the different WHO platforms for imparting country responses. We have approached the response in our national context through an inter-health facility referral system, the One Hospital Command Center. The mechanism addresses the difficulty in getting patients transferred because of surge of cases being admitted in different hospitals and quarantine facilities. Through our continued collaboration with the WHO, among others, we hope to suppress the transmission of COVID-19 in our country, addressing emerging issues and protect our vulnerable population through equitable access to vaccines. Thank you.
Thank you very much to the Philippines. And before we do move to the remaining live member state interventions, I understand that we do have a pre-recorded statement from the Republic of Korea, who is also an EB member. We would just kindly ask that statement would be played now. Thank you very much.
Us with additional updates on the progress of the WHA 73rd.1 resolution on COVID-19 response after the latest report during the special session of the WHO EB in October last year. The report reminded us of WHO's multidimensional effort, including the various technical support to individual countries, the delivery of PPE, and the response to the infodemic. I hope the vaccine supply of the COVAX facility will be accelerated as countries around the world are looking forward to receiving the promised doses of vaccines per ratio share in a swift manner. The smooth delivery of vaccines by the COVAX facility will help reverse the worrisome trend of vaccine nationalism. Following the principle of leaving no one behind, the support for vaccinations should be given to countries where medical systems have been overwhelmed. In particular, along with the help to establish a vaccine delivery plans on a national level, aids for the storage, handling, and transport of vaccines, which are typically difficult to distribute, are needed in countries with low capabilities. To that end, WHO will have to continuously cooperate with NGOs and stakeholders. Aside from vaccines, the equitable and prompt supply of diagnostics and therapeutics cannot be overemphasized. This is why the ACT accelerator has been launched, leading to significant progress in distributing diagnostics and therapeutics in developing countries. However, considering that there still remains a funding gap to be closed, standing in the way of WHO making consistent strides, further interest and participation from countries are required. Lastly, WHO should maintain its effort to share timely information and develop related guidelines regarding to emergence of the new strains of COVID-19. Following the WHA resolution, the Republic of Korea endorsed the activities of the IPPR, IHR, and IOAC that are conducting reviews based on scientific evidence and will consistently give support. We hope the committees will complete its review and finalize its recommendations by the timeline set for the next WHA. The Republic of Korea will continue to closely work with WHO and our partners to put an end to the COVID-19 pandemic. Thank you.
Thank you, Minister Kim, Republic of Korea. And we should now return to those live interventions. I should wish to give the floor again to Canada, to be followed by Norway. Thank you. And Canada, you have the floor.
Bonjour tout le monde.
Good afternoon, everyone.
Appreciate E.G. Tedros, Mike Ryan, and indeed all WHO staff for their ongoing efforts to fight this pandemic while continuing to deliver on other critical global health priorities. The results achieved in the Secretariat's report demonstrate this clearly. This is a tough time for all of us. A year after the pandemic began, much of the world continues to struggle with the devastating impact of COVID-19. Almost 100 million cases and over 2 million deaths so far, more than double the numbers just 3 months ago, with record spikes now occurring in part due to the emergence of new and more infectious variants. In Canada, the situation remains dire. Our new daily cases have tripled since mid-October, and the national positivity rate has almost doubled since then. It is no understatement to say that we are all, infected or not, suffering from COVID fatigue. It is therefore no surprise that we are all excited about the arrival of a COVID-19 vaccine, even if many are frustrated with the relatively slow rollout of doses so far. 3 months ago, the prospect of a vaccine by the end of 2020 seemed remote. Thanks to a global scientific effort, it is here. Ensuring the successful and timely global rollout of COVID vaccines is critical. We urge the international community to continue cooperating on the manufacturing and distribution of vaccines and to support fair and equitable access. To this end, Canada has committed significant resources to support vaccine deployment in vulnerable countries and populations. We are pleased to be part of the COVAX facility and also that our Minister of International Development is a co-chair of the COVAX AMC engagement group. It is equally important that member states adopt an allocation framework for vaccine distribution that prioritizes the needs of vulnerable populations and frontline health workers. This is what we have done domestically, in close cooperation amongst federal, provincial, territorial, and municipal authorities. We have prioritized our Indigenous peoples, our elderly, especially those in institutional settings, our personal support workers, and our frontline medical staff. We are also guided by an equity-based and gender-responsive approach. Finally, we need to learn the lessons of this pandemic and make changes accordingly in global pandemic preparedness and response. Canada looks forward to discussions now and then lead up to WHA on this. One critical issue is how to prevent the spread of viruses from national to international environments. We are encouraged that the WHO-led mission to study the origins of this pandemic commenced last week. This is an important example of global scientific collaboration to improve global health security. We need to look forward, not just back, and ensure that we learn now. What we learn now helps the international community to adopt more vigorously a One Health approach to global health emergency preparedness and response. Finally, again, we also encourage WHO to continue to regularly and meaningfully engage member states in guiding the directions of the organization. Merci beaucoup.
Thank you very much, Canada. And now to Norway.
Chair, Norway, as all countries, relies on the WHO leadership in this pandemic. We commend the WHO for having taken leadership during the pandemic. The whole world benefits from the multilateral system and from having a strong, independent and responsive WHO in times of crisis. We commend the way the organization has stepped up and taken leadership by coordinating and providing technical support for several global scientific studies. The pandemic also serves as a reminder of the importance of the WHO's normative role to the world, delivering guidance to all countries based on best scientific evidence is essential to managing the pandemic in the best way possible. Collaboration on all levels and among all actors involved is a prerequisite to get us out of this crisis, and broad support for global access to vaccine, diagnostics and therapeutics through the Access to COVID-19 Tools Accelerator will be important. Let us all join forces in a global solidarity to mobilize efforts to stop this pandemic and to take the world out of this current crisis. Thank you.
Thank you very much, Norway. And I understand that we also have a statement from Romania, who would be an EB member. We would kindly ask that Romania would make that statement now. Thank you very much.
Mr. Chair, dear colleagues, Romania fully aligns itself with the EU and its member states statement. From the beginning of this pandemic, we all knew that it would represent a test on how well our health system are prepared, and that the fight against it would be not an easy one. Resilience of country's social, economic and health system was very different, and a lot of work, solidarity and changes of experience should be the subjects of strategic frameworks to deal with such challenges. Romania has continued its approach focused on testing and treating those who needed healthcare, prevention, strengthening the capacities of the national health system, and design a strategic plan of the vaccination campaign that we consider a matter of national security. Continuous awareness and information campaigns about COVID-19 and needed prevention measures, public health and non-pharmacological measures, sequential put in place in correlation with local and general epidemiological trends, succeeded to keep under control the pandemic in Romania most time. Romania has redirected more than half of its budget for international development cooperation to respond to the COVID-19 pandemic, with special emphasis on the consolidation, the institutional capacity of health system, as well as countering fake in the COVID-19 context. Simultaneously, in the national territory, the refugees and asylum seekers were included in the national public health coverage, and thus their access to all necessary medical facilities was ensured. As a member state of the EU, Romania has committed through Team Europe to contribute on the global and multi-sector levels to the efforts of countering the pandemic, including the Act A initiative and the support for the COVAX facility and the EU participation to the AMC. We have reached a very important point in our fight against the pandemic with a real chance of getting good results this year. It is very important to keep the momentum and, at the same time, to continue the implementation of the public health measures that have proven their efficiency and the organization of the immunization campaign. It is very important also to ensure the respect of the human rights, a fundamental element needed for the success of the public health response and recovery from the pandemic. Thank you very much.
Thank you, Romania. And now to Turkey, to be followed by Brazil. Turkey, you have the floor.
Thank you, Chair. Since the beginning of the pandemic, WHO has been the primary global information source. While it provided guidance on existing knowledge, WHO also worked hard to fight misinformation. Chair, one of the most important deficits the COVID-19 pandemic has revealed is the lack of a global crisis management mechanism for medical supplies such as personal protective equipment. Chaos begins in the absence of order. We have witnessed that at the beginning of the pandemic as many countries experienced shortages of PPE. It is obvious that we need to build a mechanism for medical supplies to avoid such crises in the future. Global access to effective COVID-19 vaccines will be essential to end the pandemic. We commend researchers for their great efforts as we witness promising results from trials. We also appreciate WHO for accelerating the emergency use listing procedure for COVID-19 vaccines. We hope the list will expand. The pandemic reminded us the importance of capacity building and technical support. We invite WHO to make possible every effort to enhance activities of the WHO office in Istanbul, which is the geographically dispersed office established for humanitarian and health emergencies. We believe this office will be beneficial not only for the European region, but for all regions as it bridges a crucial gap. Last but not least, we would like to express our great appreciation to health and care workers who generously sacrifice themselves to fight against COVID-19. We invite all member states and WHO Secretariat to celebrate 2021 as the International Year of Health and Care Workers thoroughly. Thank you very much.
Thank you very much. And now to Brazil, to be followed by Denmark.
Thank you, Madam Moderator. Mr. Chair, let me reaffirm Brazil's solidarity to those who have lost their loved ones and to all health workers. COVID-19 remains a world crisis with profound implications for health economies and societies. Brazil has been stressing the importance of protecting lives and livelihoods in our response. Our constitution was amended to allow for extraordinary disbursements to fight the pandemic. The federal government has mobilized almost $120 billion or near 10% of our GDP. 20 billion to strengthen the unified health system with human resources, supplies, medicines, ventilators, diagnostic tests, ICU beds, PPEs, as well as to finance vaccines research, development, 20 billion in direct transfers to states and municipalities whose health-related responsibilities to fight COVID-19 was confirmed by the Supreme Court. More than $10 billion to shield the workers' revenues from lowered salaries or working hours and to support business activities, in particular of micro, small, and medium-sized enterprises. And approximately $60 billion has financed an ambitious program of cash transfer. More than 65 million people are benefiting from the emergency allowance. Mr. Chair, Brazil has also joined the international efforts to promote the equitable access to COVID-19 products and technologies. We are in the Facilitation Council of the ACT Accelerator. We are in the COVAX facility. We co-sponsor the CTAP, and we have participated in the Solidarity Trials. Mr. Chair, health systems are under pressure in many countries. In Brazil, Manaus, the capital of the state of Amazonas, faces a strong and sudden resurgence. The federal government is actively engaged. Federal resources transferred to the state amounted to $3.5 billion in 2020. The Minister of Health was in the city last week. A national task force is working to help restore the local health system's capacity. With the support of the Air Force and in partnership with the state, other public entities, and the private sector, the lack of oxygen supply has been substantially reduced. Mr. Chair, yesterday, Brazil's regulatory agency, Anvisa, granted emergency authorization for the use of 2 vaccines against COVID-19. Today, the federal government has initiated the distribution of a batch of 6 million doses of COVID-19 vaccines to all states. At this critical juncture, this executive board should make a strong call on members, WHO, other international entities, and the pharmaceutical companies to deliver in full and as a matter of urgency on their pledges and commitments to the fair and equitable distribution of COVID vaccines everywhere. Thank you.
Thank you. And now to Denmark, to be followed by Portugal.
Members of the Executive Board, delegates, Director General. Since this is the first time Denmark to speak, we wish everyone a Happy New Year. Denmark fully aligns itself with the statement made on behalf of the EU and its member states. The world is still in the midst of fighting the COVID-19 pandemic. This is also the case in Denmark. In this statement, I would like to focus specifically on the important issues of misleading information. The pandemic has reiterated the necessity, but also the benefits of providing clear, transparent, available, and evidence-based information to the public that is easy to understand and to comply with. In a digital world, news and information travel fast, and the load of information is often vast and can be confusing. Therefore, there is a growing need to work with infodemics and to fight false and misleading information. We are pleased that the WHO is taking this task seriously. We commend the initiatives initiated during the COVID-19 pandemic, but also the ambitions put forward in the draft program budget of 2022 and 2023. Thank you.
Thank you. And now to Portugal, to be followed by Uruguay.
Thank you, Madam Moderator. Mr. Chair, Director General, Excellencies, Portugal aligns itself with the statement previously made on behalf of the EU countries. We underline the importance of strengthening preparedness mechanism and essential public health services to boost readiness in the face of health emergencies. As these emergencies are bound to happen more often, we highlight the importance of the preparedness, response, and recovery cycle. The current pandemic highlights the need to build resilient health systems, providing a competent response to all spectrum of diseases while avoiding disproportional negative impacts on individuals and population, ensuring that equity, gender balance, and mental health outcomes and rights are taken into consideration. Portugal is committed to seize this window of opportunity and urges all member states to move towards a global sustainable development approach in line with the SDGs and with the guidance of WHO, assuring that no one is left behind, including migrants, conflict zones, and refugee camps. Mr. Chair, the IHR, transparency, and communication channels should serve as the basis and means to respond to health emergencies. We look forward to regular, participated, and in-depth updates on the progress of the Universal Health and Preparedness Review implementation. The rule, hope for the best and prepare for the worst, an adage usually attributed to Portuguese author Fernando Pessoa, sums up our collective intentions for the future. The year 2021 is still full of challenges to counter this pandemic, and we must redouble our efforts and support for solidarity and multilateral action coordinated by WHO. Thank you.
Thank you very much. And now to Uruguay, to be followed by Japan.
Good afternoon. Speaking on behalf of the Public Health Ministry of the Republic of Uruguay, the Minister and the Sub-Secretary, we would like to thank you for this invitation and convey our greetings to all the other members of the EB. We have drawn up a strategy against the pandemic, which has three components: leadership, management, and implementation. We carried out a quick diagnosis of the COVID situation in the country to begin with, and we set up centers to deal with it. We also provided further training to health personnel. We have boosted the number of ICU beds in our hospitals, and we are now looking to build on that. Our public and private clinics and hospitals, including care homes and old people's homes, have been covered so that they can be provided with constant support and assistance. We have managed to boost our capacity to carry out a diagnosis through using PCR tests, and we've boosted the number of laboratories able to do this across the country. We've also boosted contact tracing. Since the beginning of the pandemic, we've encouraged the wearing of masks. We've also boosted the teams of contact tracers that we have so that they have greater capacity, and we are applying the experience we've had with other disease outbreaks. We have reliable data. We provide it and use it transparently, and that boosts confidence. Our pandemic strategy has been based and focused on the individuals and their medical and psychosocial needs, and to this end we have set up a mental health hotline which has received thousands of calls. We provide free care on mental health problems related to the COVID pandemic to people who are most vulnerable, particularly the very lonely and the very old and isolated. We believe this to be essential. In Uruguay, we have teams of professionals who also deal with other similar issues, such as, for example, domestic violence, which has been a problem during the pandemic. We're now moving on to a vaccination campaign and designing that, and we will be focusing above all, first of all, on the most vulnerable groups in the population. We'll be ready to go as soon as the vaccine reaches Uruguay. Solidarity is the basis of any success here, and so is equitable access to the diagnosis, therapeutics, and vaccines available. This has been one of the biggest global health crises most of us have ever seen. We are grateful for what we can do to help us get out of it, and we hope we'll be able to reach the end of it very soon. Thank you.
Thank you very much. And now to Japan.
Thank you, Chair. Japan welcomed the report submitted by the Secretariat. We appreciate WHO to play an important role to coordinate international response in the current situation. The international team of scientists has arrived in China to start research on origins of the virus and the transmission route to humans. We wish to reiterate the importance of the international expert team to be able to access all the necessary studies and information to conduct a scientific, objective, and transparent investigation. We anticipate that the investigation fully achieves the intended purpose and discovers scientific findings. Here, I have 3 points to highlight. First, we appreciate weekly briefings and the guidance provided by the Secretariat. And in this regard, we request the Secretariat to continue to provide consistent information based on science and evidence. Second, Japan believes it is necessary to review and clarify the role of WHO in the event of public health emergencies and strengthen its transparency and accountability. We hope the WHO maintains its central role in overall coordination, swift norm settings, and technical advice during a health crisis. Furthermore, in terms of operation, resource mobilization, research and development, we hope the WHO to enhance strategic collaboration with other UN agencies such as UNICEF, UNDP, philanthropies, civil society, and private sector, considering the frameworks including ACT Accelerator. Finally, Japan wishes the WHO to continue to support essential health services and preventive public health measures and to strengthen health systems during COVID-19 response. Thank you very much.
Thank you very much. And now to Pakistan, to be followed by Myanmar.
Thank you, Madam Moderator, Mr. Chairman, and honorable delegates. COVID-19 pandemic has impacted the world in an unprecedented manner, blurring the distinction between developed and the underdeveloped health systems. Let me therefore begin by commending the very proactive role played by WHO in supporting the countries across the globe since the beginning of the pandemic. However, being a developing country did not impair Pakistan's ability to mount a robust and timely response to the biggest health emergency of our times. We were fortunate that the COVID-19 first wave was responded effectively to a large extent, and economic and social activities mostly revived. However, second wave is still prevailing, with no time for us for any kind of apathy or complacency. Since the reporting of the first cases on 26th of February, so far, our case tally has crossed 500,000, with almost 11,000 deaths as of today. Government of Pakistan adopted a comprehensive and multi-pronged approach at the strategic level and aligned its strategic decisions across the implementation processes in the country. The COVID-19 Pakistan Pandemic Preparedness and Response Plan was devised in line with the National Action Plan for Coronavirus Disease in Pakistan and the WHO's Strategic Preparedness and Response Plan. Mr. Chairman, Government of Pakistan established National Coordination Committee as the key body for policy and decision making, led by the Prime Minister himself. To assist this National Coordination Committee and to implement its decisions, a National Command and Operation Centers was also established. We therefore adopted a whole of the government approach across the country through a coordinated mechanism which is still fully functional for response to that COVID-19 outbreaks across the country. Our strategies to combat COVID-19 pandemic revolve around the core pillars: slowing down the spread of the disease, using all kinds of measures, right from smart lockdowns to testing, tracing, and quarantine, implementation of SOPs and guidelines, and of course, very quickly expanding and improving the capacity from a single diagnostic laboratory at the National Institute of Health to 138 labs across the country now. Ramping up the healthcare facilities, especially providing an additional almost 3,000 beds equipped across the country to provide adequate treatment facilities, along with equipment and supplies, ensuring medical oxygen supply, establishing a resource management system to capture and quantify essential equipment as well as supplies data. We also went on to prepare a National Health Emergency and Response Act 2020 in order to provide the legislative support to all the activities and efforts that we were undertaking. We kept on working on the capacity building of our healthcare workers in particular. Our Prime Minister's fiscal stimulus package of 50 billion Pakistani rupees proved to be essential for early COVID response. In addition, our federal and provincial governments are still providing additional financial support for the smooth ongoing country's response and preparedness. In terms of our efforts for streamlining data collection, analysis, reporting, and dissemination, we used our very effective polio surveillance and response system under the umbrella of the network of the National Emergency Operation Centers. We also try to minimize the sufferings of our people by use of the telemedicine very, very effectively. And now, last but not the least, we also have developed a very comprehensive COVID vaccine strategy. And in this context, we really appreciate the COVAX initiative, which is striving all out to ensure equitable provision of the vaccines to all countries across the globe. As of today, we have also accorded emergency use authorization to 2 of the vaccines. Mr. Chairman, we would like to thank the independent panel for its thorough review of the evidence thus far, identifying lessons and opportunities to ensure our international systems are better prepared for future pandemics is an extremely important task. We look forward to the report the independent panel will produce for the World Health Assembly. As this complex pandemic continues to evolve, to ensure our collective understanding is as comprehensive as possible, the government of Pakistan would like to express our consideration that the independent panel should possibly continue its functions beyond the
Apologies for the interruption. We would just kindly ask that you conclude your statement. Thank you very much.
So I would just like to conclude by extending my appreciation to WHO for the detailed report and also all the efforts to promote the achievement of the highest sustainable levels of health for all, aiming to strengthen and build IHR core capacities to deal with the health threats and emergency. Thank you once again.
Thank you very much. And now to Myanmar, to be followed by Thailand.
expressing our profound thanks to the Director General for his all-inclusive report on the COVID-19 response, EP/148/16. On behalf of my delegation, I wish to express our appreciation to the Director General and the leadership team for their leading role and tireless efforts in fighting against the COVID-19 pandemic. We are also obliged to the WHO for its international capacity and technical support through the Global Outbreak Alert and Response Network. Since the beginning of the pandemic, Myanmar has taken timely actions, especially in the prevention, control, and sustained efforts to curb the emerging threats of COVID-19 in the country. Myanmar has put in place a whole-of-nation approach and the principle of no one left behind to address this emerging challenge. Myanmar has made necessary preparations in order to attain the COVID-19 vaccines in cooperation with the WHO, Gavi, and COVAX facility. We have also initiated the vaccination program in line with the WHO's guidelines, including the WHO guidance on national deployment and vaccination plan. Mr. Chair, developing countries are now facing immense challenges in accessing the much-needed vaccine. It is therefore imperative to have fair and equitable accessibility and affordability of vaccines for everyone. To this end, we are grateful to the WHO for initiating a global collaboration to equitable access to COVID-19, diagnostics, therapeutics, and vaccines. We firmly believe that the COVAX facility is a great hope for low and middle-income countries to acquire effective vaccines. Since Myanmar is one of the COVAX AMEC participants, we attach great importance to secure substantial supplies of vaccines to cater for developing economies through the COVAX. Myanmar always attaches great importance to her cooperation with the WHO. I therefore wish to reaffirm our continued support to the leading role of the WHO in tackling the COVID-19 pandemic. Thank you, Mr. Chair.
Thank you very much. And now to Thailand, to be followed by Belarus.
Thank you, Chair. As this is the first time that Thailand take the floor, this is the umbrella of appreciation to our Secretariat in developing the report of our agenda. We will not mention about this again in other agenda. At this stage, Thailand would like to underscore 5 important issues. First, COVID-19 pandemic has a huge impact globally. Thus, the preparedness and response are far from perfect. We need strong political commitment, leadership, international cooperation, and good governance to enhance capacity on health emergency preparedness and response. Second, timely information and knowledge sharing are critical, not only at country level. Global community need to share knowledge and epidemiology information in fighting the public health threat. We urge all member states to strengthen the collaboration in generating evidence, sharing information, and detecting misinformation. Third, protecting the healthcare and frontline workers to have adequate PPE is critically important. There is a need to ensure procurement, supply, equitable allocation of adequate PPE. Fourth, pandemic preparedness and response must be a priority of all countries. More importantly, country and global community have to provide adequate resource and responsive technical support to turn the commitment into real action. Lastly, Chair, no country is safe until every country is safe. Health security is global security. We need global response, multilateral approach, and constructive engagement of sector beyond health system boundary to overcome this pandemic together. Thank you, Chair.
Thank you very much. And now to Belarus, to be followed by Peru.
Thank you very much, distinguished Chairperson. The delegation of delegates would like to thank the Director General for the report that has been presented. And we'd like to note that despite the continuing rise in disease incidence, it's quite clear that most countries have become more prepared for the challenges and have acquired a better gamut of know-how and tools to combat COVID-19. Much now depends on us, on our behavior and our common sense in daily life. Belarus supports future efforts of the WHO to implement a package of measures to combat COVID-19. We warmly welcome the WHO-led platform of COVID partners to fight COVID-19. We believe that the regular updating of WHO's technical guidance on COVID-19 will be an effective beacon for national health systems. Following the recommendations of the WHO, we quickly developed in our country a comprehensive plan of action to fight COVID-19 for 2020-2021, as well as various response plans depending on the development of the situation. We are using best practices in epidemiological control, lab research, as well as patient care, and work at border entry points and international passenger transfer points, and stockpiling of basic material technical means. We express our appreciation to the Euro Regional Country Office as well, rather the Regional Bureau and the Country Office in Belarus for the operational and technical support. We expect that the organization will strengthen its work on researching new variants of coronavirus and providing objective data on the efficacy and safety of new vaccines. Belarus supports the efforts of the organization to strengthen its response to emergencies. We thank you for your kind attention.
Thank you. And now to Peru, to be followed by Malaysia.
¿Me escuchan?
Can you hear me? Thank you. First of all, may I express Peru's solidarity with all those who have lost their nearest and dearest or who have been affected by the COVID-19 pandemic. We'd also like to express our warmest gratitude to those who fight so hard day by day on the front line to help us deal with the situation. We recognize WHO's efforts to help countries tackle with the pandemic, and we believe it is the responsibility of member states of all of the organization to do the same, with the advice of the organization and the support of the Secretariat, to reach agreements which will help us to improve preparedness and response to this pandemic and to those that there may be in the future, as well as to implementing the IHRs. Peru, sir, would like to reiterate its belief in the need to strengthen multilateralism, because this will ensure that we can have a better international governance of world health, and it will help us achieve universal health coverage. We know that that is a sine qua non for sustainable development. In committing itself to multilateralism, Peru, in September last year, joined the COVAX facility set up by the WHO, Gavi, and CEPI to ensure that vaccines would be accessible to everybody. It is absolutely essential, if we are to strengthen WHO's leadership, to have the COVAX facility achieve its objectives. All countries participating in it should be able to have access to vaccines in the shortest possible time, irrespective of their level of income. This goes for low-income countries and medium-income countries such as Peru, who is participating on a self-financing basis. We believe that the increasing number of vaccines and treatments against COVID-19 need to be recognized and treated as a global good, without which we won't be able to bring the pandemic to an end. The weaknesses that we had in our preparedness and response systems have been used by COVID-19 to lead us into a multi-dimensional crisis, which is having a very serious impact on our health systems. At the same time, it's putting at risk the sustainability of most of the health-related achievements that we've had in the last few years. Many countries are now facing the second wave of the pandemic, and it's having a worse impact than the first did, especially in terms of mortality and morbidity. That being the case, support from PAHO and WHO continue to be absolutely critical if we are to meet the health challenges we are now being faced with, and that includes continuing to provide basic, regular health services on matters other than COVID-19 to our peoples and populations. Thank you.
Thank you. And now, Malaysia, you have the floor.
Thank you, Chair. Malaysia takes note and thanks the Director General for the report, which has summarized continuing programs and activities undertaken by WHO and partners on the response to COVID-19. In Malaysia, both primary care and hospital services have played an exceptionally cardinal role in the health response generated. They've covered screening of suspected cases, laboratory testing of clinical samples, contact tracing, right up to providing medical care for the hospitalized patients. Malaysia further intensified our efforts to upgrade hospital capacities to avert the collapse of the already overstretched healthcare system. Despite being saturated with COVID cases, both primary care and hospital services have persevered in maintaining their existing essential healthcare services to patients while ensuring safety by adopting a myriad of innovative initiatives. In our attempts to tackle the soaring cases, the laboratory services have expanded to 62 laboratories across the country, involving not only MOH hospitals, but also university hospitals and private laboratories. At present, we are doing approximately 60,000 tests per day, and we are using the point-of-care testing, rapid test kit antigen, especially when it comes to mass screening of foreign workers within selected sectors and in managing outbreaks within resource-challenged areas. Indeed, effective communication is an important factor in Malaysia's attempt in managing the pandemic. Risk communication in Malaysia was strategized to assure the public and they're provided with consistent and accurate information in a timely manner. Evidence generated via information sharing among countries, regionally and internationally, has guided our policymakers to make evidence-based decisions. Malaysia would like to endorse this report and emphasizes that global solidarity is indeed the only way to win the war against COVID. We need unified responses to face this pandemic rather than diverse, disconnected strategy. Like Dr. Tedros said earlier, because until everyone is safe, no country is safe. Thank you, Chair, and terima kasih dari Malaysia.
Thank you very much. And now to Spain, to be followed by Ecuador. I understand we'll now have Spain.
Estimado Presidente. Chairman, Director General, ladies and gentlemen, Spain would like to subscribe to the statement made by the European Union and express her thanks for the Director General's report. We are grateful to WHO for her support and advice on the response to the most serious pandemic which mankind has suffered in the last 100 years. We acknowledge the leadership of the organization and its Director General as part of the UN system's multilateral response to COVID-19 and other global health challenges. Throughout the pandemic, WHO has made available to its member states all the resources and information it has on issues such as surveillance, best lab practices, infection control and prevention measures, clinical management of cases, preparedness, and border controls. It's also organized many meetings of experts in order to further communication and exchange between researchers and scientific institutions. We've been able to see the fruits of that intensive work. We've also been able to see how important it is to build consensus, to cooperate, and to demonstrate global solidarity. Initiatives such as Act A, COVAX, data and information exchange and the ongoing evaluation of the response to the pandemic, as well as the international health regulations, not to mention the investigation into the origin of the virus, are excellent examples of how WHO and her member states can cooperate, boost capacity, and strengthen mutual trust. We will come stronger out of this fight against SARS-CoV-2 if we learn from our mistakes, apply the lessons we've learned, and are constructive. Thank you. Thank you, Chairman. The COVID-19 outbreak was declared on the 30th of January last year as being a health emergency of international concern. We went into emergency mode on the 16th of March and developed a preparedness and response plan with support and advice from the international community. We drew up our plan with the participation of the health authorities and other key parties involved in emergency response. Ecuador each year has re-evaluated her capacity to apply the international health regulations, and we have used the self-evaluation tool for the submission of annual reports through the digital platform. This is there to make it easier to submit appropriate reports. Ecuador believes it is of crucial importance that we continue to work hand in hand on things such as developing further tools enabling us to fight more effectively against COVID-19 and ensuring that we can get equitable access to vaccines. The organization and its member states must continue to fight together, because if we do that, we will be able to bring an end to the pandemic and save the lives of millions. Thank you.
Thank you very much to all of the member states for these interventions. I should now have the pleasure of handing back to His Excellency, to Mr. Chair. Thank you.
Excellencies, distinguished delegates, we have come to an end of today's discussions. I thank you for the rich and productive discussions. We will reconvene tomorrow at 10 a.m. Central European Time and resume EB 148 discussions. Thank you. Excellencies, dignitaries, distinguished experts from the field, for giving me the opportunity to address this learned audience. तो दवाई का नाम ठीक बोला था क्या? Dear Chair, efforts for attaining the ultimate goal of health for all. Greater zeal to our efforts for attaining the ultimate goal of health for all. 28. We shall now let us consider item 2 of our agenda, report by the Director General. I have pledged
COVID-19 and other
discussions. Thank you. Of today's discussions, I thank you for the rich and productive discussions. We will reconvene tomorrow at Welcome back after the science.